and I'm an associate professor of physiotherapy at the University of Sydney in Australia. And the reason I'm making this video is to welcome you to Sports Science and Fitness in Cologne later this year in 2017, and to tell you that I'm very, very excited to be part of the teachers who are going to participate in these few days where we will be talking about all the different sports injuries. So first, allow me to introduce myself. As I said, I'm a physiotherapist, and I've been doing research in the area of sports injuries for well over a decade now. And my passion is uncovering what causes anterior cruciate ligament injuries. The short name for these injuries is ACL, and I have performed a series of studies that look into why these injuries happen in athletes and how we can prevent them. So I'm going to be giving a lecture on Friday where we will be discussing the latest literature and the current theories on how we can identify the reasons that can cause an ACL injury, what measures we can do as healthcare professionals or as people who work with an athletic population to prevent those injuries, and once they happen, we'll be discussing a little bit about what we can do to decrease the injury of these injuries happening again, which unfortunately is a quite serious danger. In addition to the lecture that I will be giving on Friday, we're going to have a 2-day pre-conference course on Wednesday and Thursday, and this is a full day course that is a combination of didactic lecture videos and PowerPoint presentations interspersed with a lot of hands-on skills where we will be practicing a lot of the things that I will be presenting. And there we'll be going into much more detail about the injury prevention programs, about the reasons, the predisposing factors for ACL injury, how the diagnosis is made from a clinical and radiological point of view. We're going to spend some time performing a physical examination of the knee. We're going to discuss different types of treatment for those athletes who suffered an ACL injury. Do they all have to have surgery? Is there a place for a conservative treatment? We'll be discussing a little bit the surgical implications and the different surgical techniques that exist and how the different types of grafts that are used guide our postoperative rehabilitation program. I will be presenting a lot of case studies for those of you who work on the athletic field with teams, and you have athletes who are coming back from a rehabilitation program after an ACL injury. We'll be going into a lot of detail about the current state of the art return to sports criteria. When do we know that the athlete is ready to return to sports? And also a lot of the more serious presentations, such as cartilage injuries that often come with an ACL injury or multiligamentous injuries. So I'm very excited to come to Germany and be part of an excellent team of teachers, both for the conference, but I'm also looking forward to working with you in the pre-conference course. So I hope those of you who work in the athletic field and you really like learning about ACL and other knee injuries, you can join us with that. So I'm really looking forward to seeing you later this year.